Chronic obstructive pulmonary disease, also known as COPD. In this video, we will talk about this disease, its causes, risk factors, signs, and symptoms, including its pathophysiology, treatment, as well as the health teaching that should be given to the patient, and the prognosis of the disease. Before that, if you are new, please like, share, subscribe, and click the notification bell for updates when a new video gets uploaded to this channel.
Chronic obstructive pulmonary disease, COPD, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs.
It includes emphysema and chronic bronchitis. COPD makes breathing difficult for individuals who have this disease. Millions more people suffer from COPD, but have not been diagnosed and are not being treated. Although there is no cure for COPD, it can be treated.
The causes of COPD includes tobacco exposure from active smoking or passive exposure to secondhand smoke, occupational exposure to dust, fumes, or chemicals, indoor air pollution, biomass fuel, wood, animal dung, crop residue, or coal. Early life events such as poor growth in utero, prematurity, and frequent or severe respiratory infections in childhood that prevent maximum lung growth, asthma in childhood, and a rare genetic condition called alpha-1 antitrypsin deficiency, which can cause COPD at a young age.
People who have a history of childhood respiratory infections, smoke exposure from coal or wood-burning stove, exposure to secondhand smoke, people with a history of asthma, and people who have underdeveloped lungs are especially at risk for developing COPD.
The signs and symptoms of COPD include shortness of breath, especially during physical activities, cough that may bring up sputum, also called mucus or phlegm, that may be clear, white, yellow or greenish, wheeze or chest tightness, fatigue or tiredness, and recurring lung infections like acute bronchitis or pneumonia. Fatigue or tiredness, and recurring lung infections like acute bronchitis or pneumonia.
In COPD, the airflow limitation is both progressive and associated with an abnormal inflammatory response of the lungs to noxious gases or particles. An inflammatory response occurs throughout the proximal and peripheral airways, lung parenchyma, and pulmonary vasculature. Due to chronic inflammation, changes and narrowing occur in the airways. There is an increase in the number of goblet cells and enlarged submucosal glands, leading to hypersecretion of mucus.
The treatment of COPD includes smoking cessation. If you have COPD and you smoke, this is the most important thing to do. Oxygen administration for those who have had COPD for a long time or severe COPD. Pulmonary rehabilitation to improve breathing and ability to exercise. Pharmacologic therapy by the use of bronchodilators, corticosteroids, and other medications. For patients with COPD, you should remember the following: stay away from smokers when you are out, and do not allow smoking in your home. Stay away from strong odors and fumes. Do breathing exercises routinely. Maintain a healthy weight and well-balanced diet, and eat 4 to 6 small meals a day while limiting simple carbohydrates and sodium. COPD reduces a patient's life expectancy depending on the stage of COPD. Patients with stage 1 COPD shorten their life expectancy by 0.3 years, stage 2 by 2.2 years, and stage 3 by 5.8 years. Moreover, if the patient is still smoking, they reduce their life by 3.5 years. I hope you learned something by watching this video. Thank you for watching.